A hernia basically is where your tissue will stretch out and it will allow other tissue to bulge through that, and it can actually get stuck to the tissue that it was bulging through, and that's where you see a hernia. The hernia can happen in the groin, it can happen in your abdominal wall, so really anywhere the tissue stretches, allowing something to bulge through, that basically is a hernia.
Got back from a wonderful cruise where we were very active. Had a wonderful time, but I had a place in my belly button, near my belly button, that was bulging, and I knew something was not right. Dr. Roshek discovered that it was an incisional umbilical hernia and said I needed surgery to repair it.
The most common symptoms that we see from hernias are actually very non-specific. So a lot of times a patient will say, I have a fullness, or I have a feeling of discomfort in this general area. The most common thing we actually see on the body is a bulge. Pain is actually a symptom that you should watch out for. If you're having sharp pains or pains that are not getting better over time, that's a sign that something may be caught inside of the hernia and needs to be addressed immediately. It's hard for us to say what actually causes hernias. There are several factors. I think the main component of the tissue stretching out is your genetics.
Went in to see Dr. Roshek, and I knew I was in a wonderful place when he greeted me at the door and welcomed my husband in. One of the first questions I asked Dr. Roshek is this the treatment that you would give your own loved ones if they had the exact diagnosis that I did? And he said, absolutely.
Once I see the patient in the office and we diagnose the hernia, then we have to decide how we're going to fix the hernia. And there are basically two different techniques, the open technique and the laparoscopic technique. After surgery, the recovery period for the patient is going to be determined on how big the hernia was, how long the surgery took, and the location of the hernia.
Recovery time, it wasn't easy, but it wasn't too long before I was back to my active lifestyle. Busy preparing to enter nursing school, had lots to do. Dr. Roshek's personality, his calmness, his demeanor gave me great confidence in having surgery with him.